I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to continue our ongoing discussions on COVID and the lockdown and the potential problems that have been created as a result of the lockdown rather than the virus itself. And this one has to do with a recent report on children and COVID. And in a single testing center, they evaluated 1,000 kids with PCR testing, where they jam the cotton swab all the way, scrape the back of your skull, and get a sample out of there. All things aside, as far as PCR testing, I've certainly talked about that in previous videos. But in this particular study, they looked at how much race played a role in whether these kids were diagnosed positive, and socioeconomic status broken down by income. Now, I have said multiple times that socioeconomic status and race is a huge player in making things worse with COVID. So that means that anything that is going to make the socioeconomic status worse of people is going to make COVID worse. Without a doubt, there's no real discussion that when we crash people's socioeconomic status, that everything gets worse, COVID included. So the fact that recently Disney announced 28,000 in layoffs, the airlines have laid off 50,000 people, Allstate's cut off 8% of its workforce, some 3,800 people, and that doesn't count small businesses. These are all attached to families, and so you now have families whose socioeconomic status is going to take a rapid decline. And with the fact that Disney is just announced these recently, means that things aren't changing. It means that people are still freaking terrified to get out of their house and live life because they continue to watch the news and worried because cases are going up, even though hospitalizations and deaths continue to trend down. Until society changes that, we're going to continue to have a shrinkage of the economy and a worsening of socioeconomic status. So what does that have to do with COVID? Back to these 1,000 children. As far as race goes, of the positive, overall it was 21% of the kids were tested positive. Of that, 7% were white, black were 30%, Hispanic was 46%. So clearly race played a huge role in the likelihood of these kids being diagnosed positive. This has nothing to do with whether they were transmissible or how sick they were. We know that children are far less impacted by COVID, but this probably has more to do with their families and how much those families are exposed. A lot of times, especially in New York, we saw the people in the Bronx and versus Manhattan, that those people they had to go to work. They couldn't just sit at home and shelter in place, and so spread was more common. But then when we bring in socioeconomic status, so they broke up income into quartiles, so top, low, and then two in between. Of the highest income, 9% of those were positive. The next highest down, 24%, 27%. The lowest income gradient was 38%. So huge difference between the highest income and the lowest income. And that's what we're creating with this shutdown in the economy and the continual fear to go out and revive the economy. It's only going to get worse unless we become smarter about this. It's not going away. We need to just understand that this is just another circulating virus and do everything we can to support our immune system. So as always, I'll post a link to this particular study in the comment section. Make sure you like this video, share it with somebody who still thinks we should be locked down and not spending any money, and subscribe to the channel.